Greetings and welcome to the latest episode of the Elevate podcast. Today, we're tackling a really important subject around our health sovereignty in relation to the proposed changes by the WHO. Both a pandemic treaty and international health regulation amendments are what are on the table right now. And whilst they've been suggested as ways to strengthen international cooperation and improve the response to public health emergencies, these measures are an attempt by the WHO to constitute additional powers, and serious concerns have been raised about the possible loss of national health sovereignty, the implementation of global public health mandates, and more. We'll talk about some of these consequences within the course of this overview, and tonight's session is part of a discussion with our Elevate community where we'll be exploring solutions to these problems. So if you'd like to be part of future events like this one, head over to weareelevate.org. Now, in December 2021, a special session of the World Health Assembly, which is the governing body behind the World Health Organization, convened, and the WHO member states decided that they would establish an intergovernmental negotiating body to draft and negotiate a convention, an agreement, or otherwise known as an international instrument under the constitution of the WHO to strengthen pandemic prevention, preparedness, and response. It's now publicly known as the Pandemic Treaty. Internally at the WHO, they call it the WHO CA+. So if you ever see the technical term, you'll now know what that means. But otherwise, it's known as the Pandemic Preparedness Treaty, although the WHO in recent weeks have started referring to it as the Pandemic Accord. Hoping perhaps that we haven't seen that sleight of hand and may associate different things with a different name, but ultimately it's the same thing. So in addition, the WHO is, to the Pandemic Treaty, the WHO is making amendments to the existing International Health Regulations 2005. Now, the draft proposes significant additional supranational powers to be exercised exclusively by the WHO during a public health emergency, and significantly broadens the scope under which these powers can be triggered. Now, this particular set of regulations in its amended form, the drafts are now available, several iterations have already been made, but these powers have the potential to fundamentally alter the role between the national state and the WHO, and would effectively hardwire into law a top-down, centralized, and supranational approach to public health, with specific reference to public health emergencies of international concern, including pandemic preparedness, of course, and the according response policies. Now, what this would do would give unelected, democratically unaccountable, centralized organization like the WHO sweeping national and international powers to directly interfere with people's lives. Up until now, the WHO has been empowered to make recommendations to its member states. However, the amendments that are on the table right now threaten to change this. Firstly, in terms of contributions to the WHO, as we know, the WHO is funded by a combination of sources, everything from membership dues from member states, but also now an increasing amount of finance from private and corporate actors and big industry. Now, this new treaty and its amendments would mandate financial contributions to fund pandemic response activities. And I'll come to how much that could amount to towards the end of this part of the section. It would require the surrender of intellectual property and technology related to pandemic response and other public health emergencies to the WHO, mandate the manufacture and distribution of vaccines and other health products, override national safety approval processes for vaccines, medical devices, and diagnostics. We know that the central bodies have had a woeful record in recent years in that regard. So giving such powers to the WHO with its intrinsic connections to the big pharmaceutical industry is a shocking prospect. Requiring citizens to declare their medical status, that's right. Think medical passports once again. They continue to raise their ugly head. And in fact, medical certification is mentioned in a number of the articles throughout the international health regulations. It's one of the most commonly referred to elements, so certainly hasn't gone away. As we saw within the last COVID chapter, forcibly quarantining citizens and preventing citizens from traveling. And effectively, what we'll see is the baking in of the methodologies used to respond to COVID-19 into future pandemic preparedness if we're not careful. And of course, the WHO would gain the powers to medically examine, inject, or otherwise members of the public. Now, these protocols will expand the global health surveillance system in the name of identifying public health threats, such as viruses, and of course, variants of concern. Now, what's the timeline for the implementation of these regulations? How long have we got to ensure these are either appropriately amended or taken off the table altogether, or a full reformation of the WHO, or even replacement of the WHO, all possible options that we should be considering. But nonetheless, in the context of this conversation, the WHO plans to have the treaty and the international health regulations ready for approval by the 77th International Annual Meeting of the WHO, where the World Health Assembly, the governing body, convene in May 2024. So we've got just over a year as it stands, because we've already seen certain timelines amended with the news of other possible health threats that seem to be banded around in the news and suddenly disappear. The draft instruments are currently making their way through the WHO's open and closed committees and are subject to both internal and external reviews. But of course, the public are somewhat distant. And unless you are a practicing lawyer, and even if you are a practicing lawyer, if you have little health experience in the health world, then some of the technical jargon within these articles may be far above your head. So for our ability to actually discern what is happening, it requires teams of people like we've started to witness across the world who are scrutinizing these documents to help us all understand what exactly the WHO is attempting to achieve. And already the WHO is in denial of some of its aspirations, despite being written into their draft regulations. Tedros came out this week saying that the WHO will not be removing national sovereignty. I beg to differ. The articles say otherwise. Now, it is a nuanced discussion. I will give you that. You know, the first article clearly states that national sovereignty will be retained. However, the wording throughout the document, which we'll talk about, shows that that is not exclusively true. So it's a difficult conversation. They are unlikely to have full corresponding power over any sovereign state. However, there is definitely an accumulation of power and centralization of powers that will have very distinct ramifications for individual member states should they approve the regulations. So the IHR, the International Health Regulations, as it's an existing legal framework, it only needs a simple majority of its member states to be approved. So it will go to the vote, and if the majority vote yes, then it's approved, and then a member state has a maximum of 6 months as it stands to opt out. Otherwise, it's considered as accepted. Now, that 6 months is down from 18 months. There is speculation it could be increased to 10 months, but as it stands, 6 months from the point of approval, which gives, again, a further window if, say, the United Kingdom or the nation that you are represented by does approve these regulations. It gives a further window to try and pressure national governments to actually veto that decision and opt out. The treaty, however, is a brand new legal framework, so it requires approval of 2/3 of its member states. So it's got a very specific benchmark, and we'll talk about that as we go into the solution section of this conversation. So to summarize some of the key changes, and there are a lot, certainly more than tonight's session will allow us to cover, I'll point you to some other resources. There's a brilliant resource by James Roguski, who I'd invited to be with us tonight but couldn't make it. He's written 100 reasons why we ought to veto the amendments with corresponding videos, articles, and references. But I want to summarize some of the key changes. So the WHO is seeking centralized powers to determine the preparedness and response to future pandemics, including pharmaceutical interventions, of course, binding powers as the guiding and coordinating authority, that's the wording used, of the international health response, where we see language changes from recommendations to nation states would undertake to follow. Sounds like coercive language to me. The new amendments expand the scope under which the Director General can declare an international public emergency, and now even a potential emergency may be declared. What's determined a potential emergency? Yes, you've guessed it, very little guidance. But the discretion, of course, is held by one individual, the Director General of the WHO, and that Director General has a rather checkered history. That's too much of a story for today's episode, but one that we'll expand in on the future. But if you hadn't realized, Tedros was re-elected for another 6 years at the WHO, and guess how many candidates he went up against to get re-elected? That's right, a big fat zero. He came in without opposition and was re-elected for another 6 years from 2021. That was a big story that we seem to have missed. And here he is wielding immense power over an organization. But there's a lot of reasons to be doubtful over his leadership, which we'll talk about another time. You will also see the increase in institutional and surveillance powers of the WHO, a deviation from the universal human rights, specifically in the wording. And again, this is definitive so far. The subjective definition of equity, inclusivity, coherence, and in accordance, their common but differentiated responsibilities of member states. States take into consideration their social and economic development is the new term that replaces the objective universal human rights as set up by the UN, which implies a hierarchy based upon wealth, as well as a whole range of other manifestations that sound quite truly woke, as much as I don't like to use that term. Private and corporate interests, of course, stand to benefit significantly from the new arrangements. There is so many financial windows of opportunity within these. In fact, these two documents are dripping in financial opportunities. And it's no surprise to see that Bill Gates himself has been actively involved in the preparation of some of these documents. The centralized coordination of resources is being stipulated with powers to instruct member states to provide the WHO and other countries with resources. Now, the centralization of resources, where have we heard that before? Think about a political context where the deep centralization of resources has happened in the past with atrocious consequences. Now, I'm not saying that the WHO are seeking complete and utter centralized control of the World Health System, although there are certainly some articles that would hint at that, and we should have due concern. Of course, mandatory data sharing with the WHO and intergovernmental organizations. That's right, your data is not safe with the WHO and its trusted partners, of course, and its widespread wings into the pharmaceutical industry and related organizations. Control of information is a big one. Censorship powers to coordinate what they call infodemic management of disinformation and misinformation. You know, we've seen that the WHO has been seen as the single source of truth by the social media platforms, a fallacy that would have Orwell and co rolling in their graves. It puts the regulatory approval of new drugs in the hands of the WHO in the context of a pandemic and gives the WHO powers to restrict the freedom of movement. Now, if there is some good news, the treaty itself is a much lesser document. The treaty is more focused on a practical nature and outlines the infrastructure, logistics, funding required to implement the proposed changes. So really the big document that we need to be most concerned about in the first instance is the international health regulations. It is these regulations that will underpin the pandemic preparedness treaty or the pandemic accord or whatever they want to call it. Which is really about the practical manifestation of it, which gives us an understanding of how these regulations may be used. So both documents are incredibly important. Both have a tight timeline of just over a year. And we cannot rest on our laurels and leave it to the last hour to challenge these developments. It's important that at every step of the journey, we resist these particular amendments and ensure that the document is either abolished or entirely reformed. I know many of you, like myself, will have different ideas about how they would like to see the WHO end up, whether that's completely reformed or replaced altogether. And that is another conversation, again, for another day, and an important one as we seek solutions to this particular problem. Now, I want to close out just by summarizing a few things. Now, the WHO itself was formed back in 1948 as a specialized agency of the United Nations responsible for public health. Its mission is, at the time, you would have thought, to ensure that everyone can achieve the highest possible level of health. However, its funding model changed significantly in the 1980s. From a proportional funding system where member states funded the organization based upon their overall economic well-being, such as their GDP, and now expanded significantly to include private and corporate interests, including, of course, Big Pharma and organizations like the Bill and Melinda Gates Foundation. Of course, since this change, the WHO's priorities have subsequently shifted from a community healthcare approach to a commoditized healthcare approach, inevitably following in the interests of their newfound funders. In fact, 80% of the budget is now called specified funding, where funds are allocated based upon the specification of its funders. The Gates influence is significant. Over 10% of all funding, if not more, through his various subsidiaries, is channeled through the WHO, and subsequently vaccination has become a central focus for the WHO, so much so that in 2011, Gates spoke at the WHO Accord and declared that all 193 member states must make vaccines a central focus in their health systems. Lo and behold, the following year, the WHO, the World Health Assembly, introduced a global vaccine plan that the Gates Foundation co-authored, and it's rumored that over 50% of the overall WHO budget is now vaccine related. And of course, other private-public partnerships such as Gavi and CEPI have emerged, where Gates is also heavily involved, and these are specifically focused on promoting vaccine-driven responses. Now, these are specific concerns in the context of what we've seen over the last couple of years, but not just the last couple of years, the increasing prevalence and reliance upon vaccination. If you look at the United States, about how many vaccines have been approved over the recent decades, you'll see there's an overwhelming shift towards a vaccine-driven approach. Now, we have to ask bigger questions of the WHO in terms of its overall model when it comes to international healthcare. But again, that's a conversation that is much broader than this conversation allows. But it is something we need to consider as we look at the big picture when we approach how to tackle these specific problems of the WHO, because we have to ask bigger questions around whether the entity, the organization itself, is fit for any form of global health governance. And we need to scrutinize not just these regulations and these treaties, but its overall approach, its undemocratic nature, its lack of transparency, its corruption, its conflicts of interest, and its woeful leadership choices. Now, many civil society organizations have stated for a long time that the WHO's independence has long been compromised, and this itself provides a trail of investigation when we move forward and discuss solutions. And finally, given that we've just been talking about pandemic preparedness, well, the WHO itself lists just 4 pandemics in the past century, of course. In fact, 3 now, now that we're in the 2020s. If you go back a couple of extra years, you'd include the Spanish flu. But just in the last century alone, you had the 1957 to 58 pandemic, the 1968 to 69 influenza pandemic, H1N1 in 2009, and now, of course, the COVID chapter in 2020. So you would have to ask, with so infrequent public emergencies in the nature of a pandemic, why the WHO is doubling down in such a way and even creating a fund that could rise as high as $31 billion. And to put that into context, that's 10 times larger than the entire annual WHO budget. What on earth are they going to do with that money that is ultimately going to come from its member states and its private partners? And of course, you and I, the taxpayer, are inadvertently footing the bill. So there are lots more questions to be asked, but the question we need to ask now is, what can we do about it? And that is exactly what we'll be doing now within our private community discussion here in the Elevate community. Now, I want to invite you, if you're watching the podcast version of this, please do share this episode. It's important that we get an overview of what these proposals threaten and get very clear on the steps that we can take. So within our community now, we're going to open up the conversation to look at what some of those solutions could be. And if you'd like to be part of those conversations in the future, then please head over to weareelevate.org. Thanks very much for tuning in. I'm off now to join our community to unravel this problem and see what we can come up with as a set of solutions to tackle these very issues. Thanks again for watching.